Thank you for joining me today to learn a little more about microstomia and facial contractures, along with our new OraMPA microstomia appliance and the OraPlace contracture tools. My name is Sarah Schumann. I'm a speech pathologist and the Director of Education and Outreach at Cranial Rehab. Following the webinar, you can reach me at the email you see on the slide, schumann@cranialrehab.com. So first, I will briefly discuss microstomia and facial contractures, and then I will dive into more in-depth information on the tools we offer that may be useful for treatment. Let's start with a brief overview of orofacial contractures. Shortening of muscles, skin, and tissue cause contractures. In the face, common locations for contractures include the oral commissures, the vermilion border, the philtrum, the nasolabial folds, nasal alars, modiolus, mentolabial junction, and around the eyes. Now moving on to microstomia, literally meaning small mouth. Microstomia is a significant reduction in oral opening, particularly at the oral commissures, where your upper and lower lips come together. It results in functional impairments and causes difficulties with nutrition, speech, oral hygiene and dental care, intubation, and overall quality of life. So now that we have quickly addressed orofacial contractures and microstomia, I'm going to show you a few therapy options that we offer. This is a OraMPA microstomia device. It is a handheld, single patient use device for the prevention and treatment of microstomia. It provides the patient with multiple stretching options. The device includes a rampa appliance, a pack of elastic bands for dynamic stretching, and a pack of wraps for static stretching. The OraMPA device may be used for a variety of patients with microstomia, including from facial burns, radiation fibrosis, trauma, craniofacial disorders, surgical reconstruction, and scleroderma. The device may also be used for orofacial myofunctional training to strengthen the lips and the face. Contraindications include active infections, open sores, wounds, infected grafts, or the presence of sutures or bolsters. We recommend caution for patients with osteonecrosis and loose teeth, recent oral commissure surgery, or facial grafting. Supervision is needed for pediatric patients, patients with cognitive impairments, and patients who cannot remove the tools independently. The OraMPA device provides 3 stretching options. Manual stretching allows the patient or therapist to control how much pressure is applied by squeezing the legs of the device with their fingers, as you can see in this photo. The patient is able to increase and decrease resistance as desired. Dynamic stretching uses movement to create a stretch. The dynamic bands are pliable, allowing for the patient to push against them and release. The size of the dynamic band used determines the amount of pressure applied against the lip commissure area. With static stretching, the Velcro band does not allow for any movement by holding the stretch at a fixed location and pressure. When considering what type of stretching option to use your clinical judgment by looking at 2 main factors. The first factor to consider is, what is being treated? Is it scarring from surgery, post-burn, fibrotic tissue from radiation? Secondly, how much time has passed since the initial incident? For example, if a patient had a facial burn, is it 3 weeks post-burn, 3 months, a year or more? Manual or dynamic stretching may be best suited for patients who have undergone lip excisions, surgery, or facial trauma. Static stretching may be best for patients who have had chemical or thermal burns during the first year to prevent and minimize contracture occurrence. The OraMPA appliance comes in 3 sizes: severe extra small, standard, and broad semi-circumferential. No matter how you plan to use the device, first wash it with soap and water and dry with a towel. Then, if applicable, add a dynamic band or the static Velcro strap. To insert, squeeze the upper arms and lip cups together. Place 1 lip cup inside and against the lip commissure. Rotate and place the opposing lip cup against the other lip commissure. Then, if applicable, follow the steps for securing the static strap. Lastly, release the upper arms, allowing the device to expand and press the commissures apart. So here's a short video demonstration of the RAMPA device and the 3 stretching methods. So today Rob is going to show you our OraMPA microstomia appliance. It comes in 3 different sizes. The one he's showing you now is our standard size. Then we also have a severe extra small size. You can see that's for much smaller openings. And then we also have a semi-circumferential size. With that, we also have 3 different ways of stretching. We have manual stretching, so Rob's going to go ahead and insert that in his mouth. And it sits in between the lip commissure areas. And you can manually stretch with your fingers. So the therapist can do that or the patient can do that. Okay, so now we're going to go ahead and show you how to use that same device, but with the power bands. So these dynamic bands, they go ahead and they fit on the arms of the device. So there's 2 different sizes there. So Rob's going with that bigger size. Then he goes ahead and he squeezes that top area together again and inserts it, and he allows it to do a dynamic stretch. So there's a little bit of flex in there because it's using that band. So he can actually push against it if he chooses to. The last way to stretch is doing a static stretch, and for that we use our strap here. And this is our static strap. So you can see it attaches on one arm, and then you would insert the device, and then you would use that band to create the pressure, and it would stop right in place where you want it and hold a static stretch. So that does not allow for any flexibility at all. It holds that stretch very firmly in place. So those are our 3 sizes and our 3 different ways of stretching. These are a few suggested protocols depending on if you are using manual, dynamic, or static stretching. We do not have research on these protocols with this specific device, so it is critical that you use your clinical judgment. For manual stretching, we suggest 3 sessions daily, each session containing 5 stretches that are held for 30 seconds each. For use with the dynamic bands, we suggest 3 times daily, each stretch being held for 30 minutes. Lastly, for use with the static strap for non-burn patients, we recommend 3 times daily for 30 minutes. For burn patients, we had difficulty finding literature with suggested protocols for use, so again, use your clinical judgment. We know we will want longer stretches with the static stretch. However, the lip commissure area is sensitive to breakdown, so that must be considered and continuously reevaluated. Cleaning and care is quite straightforward. Clean the device with soap and water, rinse and dry thoroughly, replace the dynamic band and static strap when they begin to show signs of wear and tear. All right, now moving on to the OraPlace facial contracture tools. These tools are handheld single patient use for intraoral stretching. They provide a 3-dimensional stretch working from the inside out. They can be used preventatively, allowing the patient to start rehab early on. In the case of burn patients, they may be utilized a few days after grafting or surgery versus weeks or months. The tools come in 3 shapes: the bar, the ball, and the boomerang, and each shape comes in 3 sizes. There are many benefits to using the OraPlace tools. They provide slow graded stretching, which addresses both the muscles and the skin at the same time. They improve range of motion, providing a better end range and encouraging facial reanimation. They improve symmetry. Depending on where the injury occurred, not all patients need to target both sides of the face. They also improve lip closure, benefiting drinking, eating, and speech. Lastly, but not least, they're easy to use and accessible for patients. The tools are designed to be placed in the mouth for a low-load, prolonged stretch of the orofacial musculature. By doing a prolonged, low-load stretch, both the muscles and the skin are targeted. They may be put in place with no added pressure to provide a passive stretch, or the patient or provider can push gently against the oral tissue to provide a more intense stretch. A benefit to the tools is that they may be used in acute care with ventilated and sedated patients, allowing for the prevention and treatment of contractures without patient participation. The OraPlace tools were created specifically for burn patients, but we see many possibilities for use. They can treat facial contractures from all sorts of burns, scarring incidents, and surgeries, including cancer reconstruction. Potential uses of the OraPlace tools include oral motor exercises for NICU babies. Furthermore, the bar-shaped tool is an optimal design to treat cleft lip repair scarring. Contraindications include active infections, open sores, wounds, or infected grafts. We recommend caution with patients with osteonecrosis and loose teeth. We recommend getting doctor clearance for patients with recent oral commissure surgery and recent facial grafting. Supervision is needed for pediatric patients, patients with cognitive impairments, and patients who cannot remove the tools independently. Providers such as SLPs and OTs have an important role within the interdisciplinary burn team. It is essential that they assess the patient on a consistent basis as burns are progressive and constantly changing. Thus, treatment may also need to adapt. As previously mentioned, the OraPlace tools come in 3 different shapes: the bar, ball, and boomerang. Each shape is designed to target specific areas, although there may be some overlap. The 3 size options offer a graded stretch and allow the tools to be used for a variety of populations and needs. The ball shape targets areas with deep pockets, such as the nasolabial folds or by the chin. The bar shape targets the mental labial junction, so the lower lip, or the upper lip and the philtrum. The boomerang shape is angled for comfort along the upper and lower jawline. It is important to provide a thorough evaluation before using the tools. The measurements should focus on functional changes in range of motion, including lip closure, oral opening, labial spread, elevation at the corners of the lips, lip pucker, and facial symmetry. For example, to assess labial spread, have the patient smile broadly and measure between the left and right lip commissures. Measurements should be done pre and post-treatment as well as weekly. These measurements can be done with calipers or with our new OraStretch deflection scales that you can see here in this photo. Photographs allow for visual representation of changes. We recommend taking photos of the patient's face at rest, as well as with a variety of facial movements, including maximum excursions and facial expressions. Each of the tools has a flat side and a rounded side. The rounded side faces outward and the flat side lays against the teeth or the gums. The goal while using these tools is to stretch as long as the patient can tolerate. The more acute the injury, the less time needed. One of the advantages to using these tools is the ability to target a specific area. For example, if there's scarring on one side of the face and not the other, you are able to target just that area. To begin using the tools, first find a size that provides a tolerable stretch and insert into the target area in the oral cavity. It is okay to start small. If the tool slips out, then you know it is too small and need to size up. Also move up in size if the patient has no physical feeling of stretch, if there is no visual cue of a stretch, and if there is no resistance against the tool. Stretch to the patient's comfort level. They should feel a 4 or 5 stretch on a scale of 10. For the prevention of contractures, you will want to start as early as possible. For burn patients, this can be as early as during acute care, as long as there's no bleeding on the graft or otherwise. For the prevention of contractures, the patient should use the tools 4 to 5 times a day for up to 1 hour. They should not be used for longer than 1 hour intervals, as they could create a wound. With burn patients, scars can progress for up to a year, so use preventatively for that year. For treatment, the patient should use the tools 30 to 60 minutes, 2 times daily. If the patient is not able to comply with this protocol, keep in mind that they can still have success with less. Do the stretch to the patient's tolerance. Remove tools as needed to suction or to have the patient swallow their saliva. Then you can reinsert. Some discomfort can be expected due to the stretch, but the patient should not feel any pain. Now we will watch a short video demonstration using each of the OraPlace tool shapes. We are going to demonstrate each of the large OraPlace shapes today on Rob. We will start with the bar tool, which is designed specifically to target the upper and lower lips. Keep in mind the facial muscles often overlap and intercross. If you see that someone has an inverted upper lip where it rolls up, or an everted lower lip where it rolls down, this is because of tightening of the musculature in these areas. You may find that if the patient has a severely inverted lip, there is not much space to get a tool in there, so when you begin treatment, you may need to work the corner areas first until you can get down under the lip. To target the upper lip, place the tool underneath the lip to provide a nice, easy stretch. Okay, Rob, go ahead and turn your head to the side. Is this uncomfortable? No. Is this painful? The patient should not experience pain or discomfort during this stretch. Our goal is to have this in as long as possible. Depending on the patient, they can sit and hold the tool in place, or we can hold it for them. Sometimes it will stay in place on its own. Okay, moving to the lower lip area. If you have difficulty slipping in the tool, gently grab the side of the lip with your other hand and then push in the tool. Once in place, the stick may touch their nose, but again, you'll see the stretch here. So go ahead and turn to the side. Now this is important to think about when you use these tools. Even when stretching down through here with the bar-shaped tool, it is also slowly impacting the platysma. The platysma muscle is a muscle of the neck that inserts right about here. By stretching these muscles, you're pulling the platysma up, and you're going to see secondary effects down below the chin. Our second tool is the ball shape. The ball shapes are intended for the area of the modiolus, up to the nasolabial folds. The modiolus is the point lateral to the angle of the mouth where several facial muscles converge. Also note that the ocular muscles, when contracted, can pull the eye downwards. By placing the tool high in the oral cavity, it will stretch those muscles as well. So let me show you on Rob. Open up, and now close. You can see that I can control the pressure depending on how much stretch I want. Now to stretch the modiolus, you can place it right here. You can move it back a little too, but generally we want it right at that modiolus point. It's more effective if the patient can keep their lips closed. So go ahead and turn to the right so we can all take a look at that stretch. Okay, open again. We're going to target now up by the nasal labial folds. The stretch is harder to see, but if you compare left to right, so go ahead and turn your head from side to side. You can see how much flatter it is on the right side of his face where we're not stretching. Okay, go ahead and open up. Lastly, we will look at the boomerang shape. It is specifically angled to go along the bottom of the jawline, and it flips upwards to target the cheekbone area as well. So this area and up in here. For a more intense stretch, you can turn the bottom edge outwards. This one I like to twist as I put it in. All right, so go ahead and open up, Rob, and we're going to target the bottom of the jawline. You can see the nice stretch there. Go ahead and turn to the right. Okay. Now, again, if I want to, I can turn that bottom edge outwards to intensify the stretch. Now let me show you up on top. So I'm going to go ahead and insert it again, and I'm going to twist it upwards. So you can go ahead and see that nice stretch there. You can also use the tip of the boomerang shape, pointed outwards to target the modiolus if the patient's opening doesn't allow for use of the small ball shape. So that looks like this. And you can see that nice stretch. One thing to keep in mind is that just because you're using the large shape, the large size of one shape does not mean you need to use the large size of the other shapes. For example, you can use a large bar shape and a small boomerang shape. All right, so moving on, cleaning the OraPlace tools is very straightforward. You use warm water and soap, and you do not apply any chemicals or lubricants. So as of yet, we don't have any insurance coverage for the OraPlace or the rampa devices. There's a couple ways you can order. You can order with a purchase order by submitting that with fax or email. A patient can order directly on our website, so they are available to be purchased with a credit card. And then you as a provider can submit a prescription order form, and we'll then reach out to the patient to have them purchase the device. All right, so the last tool I want to introduce you to is the OraStretch Press. This is used for the prevention and treatment of trismus. It's a handheld device intended for single patient use. It is lightweight, easy to use, and has documented efficacy. It opens to 50 millimeters, which is the average adult MIO. There's a scale on the side for easy measuring and a limit screw on the top. In the Clayton, Wart, and Mates research article, Full Thickness Facial Burns, Outcomes Following Orofacial Rehabilitation, patients utilize the OraStretch Press and similar devices to increase vertical opening of the mouth. They found that for patients with full thickness burn, therapeutic intervention was beneficial. As many of the patients that may use the OraStretch Press have microstomia, we have created the interior version. As you can see in the bottom photo on this slide, this is a much smaller bite plate intended for patients with microstomia or those who have had an area that needs to be avoided during the sides or back of the oral cavity. For example, areas to be avoided may include those with a wound or those that have tissue obstructing the standard mouth plate, such as from a flap surgery. To have access to the OraStretch Press, there's a few things that you can do. You can submit a prescription order form, and we do often have coverage for the OraStretch Press, so our team will check insurance and then reach out to the patient to let them know their coverage. The patient can also order online and pay with a credit card, and then submit that on their own to their insurance or just pay out of pocket. So please feel free to reach out to us with any questions on ordering. But like I mentioned, it is a pretty straightforward process. On this slide, you'll find the references we utilized to create this webinar. I highly recommend taking a closer look at them as they provide a lot of fantastic information. Thank you very much for attending this presentation. If you'd like more information, do not hesitate to reach out to me at schumann@craniorehab.com or give us a call at 1-800-206-8381. I very much look forward to working with you. Bye-bye.